रागादिरोगान् सततानुषक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै. In the previous class, we had started with the disease name as Ajeerna, and we had covered the Kriya Sharira aspects of it. I'll just run through the slides. So we had discussed about the hormonal control of the gastrointestinal motility and the neuronal control and how it is related to the doshas in Ayurveda. So finally we understood that it is because of the Prakrita Vata Karma, saying about Sarva Sharira Dhatu Vyuhakara or Vayustantra Yantradhara and Pravartakas Cheshtanam, Uchchavachanam, seeing all these explanations given in Charakash Sutra 12th chapter, we understood this is relatively contributing to the field of neuronal activity and the hormonal activity, the control of the digestive system through these two. Okay. Then we had discussed about what is Amashya, what is Pakvashya. We had discussed about Abhyantara Roga Marga and why Ajeerna is considered under the Abhyantara Roga Marga. We had discussed all this. And once Ajeerna sets in, there can be many other different rogas that can manifest in the body. So those are Jvara, Atisara, Chardi, Alasaka, Visuchika, Kasa, Shwasa. So all these we had just discussed in brief. As this is the first Vyadhi we have taken up for our discussion, we have not gone into the depths of other specific Vyadhis, but we had discussed about how deviation in the Kriya Sharira of the Pachana Kriya leads to Ajeerna, Ama, then it manifests as a particular specific disease. Okay, this we had discussed. And we had discussed about Annavaha Srotas, where it is located, and what are all the rogas that can manifest through Annavaha Srotas. So finally, we came to a conclusion that Ajeerna was a root bug, which can manifest being an Abhyantara Roga Marga Vyadhi. Then we had discussed about Pranavayu, Udanavayu, Samanavayu, Pachaka Pitta, and Kledaka Kapha, how they act or how they aid in the digestive process, that is the Pachana Kriya, how they act in an orderly manner, in a combination, how they act up. So it was called a play of subtypes of Tridosha. Then we discussed about what is Pachaka Pitta and what is the difference with Agni, or are they same, or will they take over their actions at certain point of time. These we had discussed, and how they influence each other, and also how they influence Dosha, Dhatu and Mala. So we got to know that from the Dhanvantari Mata, the Pitta is called as the Pachakam, but according to the Atreya Mata, Agni is called as the Pachaka. Then we discussed about what are 4 types of Agni. So it's Trikshna Agni, Manda Agni, Sama Agni, and the Vishama Agni. We specifically discussed about actions of each and every Agni, and we also understood that it is not that every person would have one kind of Agni for his whole lifetime. It is according to the avastha he is in. So it can deviate according to the Prakriti, according to the Kala, according to the Rutu. It can deviate slightly. That we have understood now. Then how much Agni is important? And we understood there are 2 points. One is the Ashraya, the other one is the Ashrayi. So Ashraya, the Agni is actually placed in Grahani. This is what we have understood now. So Tadadishtanam Annasya Grahana Grahani Mata. So this we discussed in the last class. And we also understood that with the correlation of which dosha to which type of Agni. So Mandagni always goes with the Kapha Prakriti, or there is Kapha predominance in the Amashya. So at that time there would be Mandagni, and Tikshna Agni in the Pitta condition, Vishama Agni in the Anila, that is Vayu. If see, there are 2 things. One is about the Prakriti of the individual, the other is about the in the environment that is given in the Amashya. We generally use the term called as gut health. saying about how much good bacteria is there in the intestines. We use this term, right? Gut health. So likewise, we can use these terms also, like the health according, I mean, health in proportion with kapha, the health of the amashaya in proportion with pitta. So if you can take the example, there is a mucus lining in the stomach, so that we understand it as kapha, that we can understand as kleda bhava. If that has increased too much in the quantity and quality, what happens? Then Agni, the acids that are produced in the stomach cannot act properly. So at that time, there would be Mandagni. Then in the other condition, if you take, if there is more acids and if there is more gastrin hormone production, which induces the HCl to increase more and more in the production. So at that time, there would be Tikshnagni. So there is no much mucus to act opposite to the Tikshnagni. So at that time, there is Kapha decrease and Pitta increase. At this time, this can be a Tikshnagni. So it's not just about the Pitta Prakriti individual having a Tikshnagni, but it is also the Avastha of the Amashaya and Pakvashaya having Pitta predominance in their environment such that it leads to Tikshnagni. Likewise, it can be about Vishamagni, it can be about Samagni. So how do we examine Agni? It is from what is the digestive capacity of the individual. So if the digestive capacity of the individual is more, that means to say, for example, he has taken 100 grams of food and he can digest it in 2 hours, say, just for example. So in another individual can digest it in 3 hours. The C individual can digest it in 4 hours. So in whom do you say that the Agni is good? It is in a good state. You cannot say that it is just in the person who takes up just 2 hours for the digestion, he is in a good state of Agni. No, it depends upon the Prakriti. So if the Prakriti of the individual was Kapha, he would take more time to digest. But what is the final outcome? There is no vibanda in him, there is no burning sensation, there is no adhana, there is no other bloating kind of sensations, there is nothing like that. He is absolutely in pitch with the physiology of the body. Then, even if the person takes 4 hours for digestion, or in the other case, he takes 2 hours of digestion, it doesn't make much difference. It is just individualistic. So Agni, Jarana Shaktiya, Parikshita, you cannot actually compare two different individuals with two different Prakriti and two different Desha, Kala and such things. You have to just take, uh, you have to just see the person from how he was 10 years before, how he was 5 years before, how he was 2 years before, or just 2 months before, how his digestive capacity was. Only with that you can compare. So never compare the Agni, the Charana Shakti of one person with the another and then say this person has slightly increased, I mean, slightly at a better condition of Agni and this person doesn't. No, don't do that mistake. While you sit in the OPD, please make sure to ask the patient the history very properly to understand what is the Agni Bala. Okay. Then we will move on to what is Apakva Anna and what is Pakva Anna. We had discussed about this. So Apakva Anna is in Dharana, in the Amashaya. Once it gets to Pakva state, then it is sent to Grahani, then it is sent to the Pakvashaya. So if what the pathological condition that you can understand here is, if a person was taking 5 hours for digestion after a proper meal, after a normal sufficient quantity of meal he has taken at 11 o'clock, say, and he'll digest that almost the complete digestion is over by 4 o'clock. This was his normal routine and this was his digestive capacity from so many years. But now what is happening? The digestion, he is not feeling that satisfaction and emptiness in the stomach even after 7 hours. So what you would say here? The apakwa anna is in dharana in the amashya for longer hours now. Just the comparison with the very same person. So this person may end up in ama and this person may end up in Ajeerna, which further contributes to many other diseases that we will discuss today. Okay. So what is actually Kshuddha? Kshuddha or Bubuksha? Bubuksha is generally termed as hunger, right? So whether it is just a physiology, saying it's just a play of nervous system uh, giving you some intimation that you should eat food now, is it just that, or is it is it just the body telling you you need something for the energy, so pick up something, eat up something? Is it like that? No. Bhava Prakasha in the Dinacharya Adhyaya says there are four things that we call as vancha. Sharire jayate nityam vanchan runam chaturvidaha. So there are four vancha. That means to say, in order to sustain this body, this sharira, which is the conglomeration of sharira, indriya, manas, and atma. This sharira is built up of all these, right? It's a conglomeration of all these. So it has a vancha. What are those four? Bubuksha, pipasa, sushupsa, and ratispruha. So let's not go into the other three aspects. Today we are just concentrating on bubuksha. So as we all know, Kshudha is also a Vega. Now we also understood this is a Vancha. And Acharya Sushruta gives a very important feature about this Kshudha also, saying it is a Svabhavika Vyadhi. So, do we, I mean, we don't even get the perception of saying Kshudha as a Vyadhi, right? Only Ajeerna is a Vyadhi for us, and Alasaka, Visuchika, Udara Roga, or Atisara, Kasa, all these are Vyadhi for us. But we don't look at Kshudha in the aspect of saying it as a Roga. But from Ashtanga, Charaka, and Sushruta, we have until now we have understood Kshudha as a Vega. Then Bhava Prakasha is saying it as Vancha. Then the third thing is Acharya Sushruta in the very first chapter of Sushruta Samhita says Kshudha is a Swabhavika Vyadhi. So this is a Swabhavika Vyadhi, a natural thing to any human being or any living being, this cannot be just neglected. It has to be just maintained. Okay. So that is why we take food so that it's properly digested and we get energy out of it and it sustains our life. So what is Ajeerna? Now actually going into the topic specific. So we have understood until now, being in fourth year or in the internship of medical college, Dosha eva hi sarvesham roganam ekakaranam. So what is that one reason which is responsible for the roga to manifest? It is dosha. It is not just one dosha. They have mentioned it in Bahuvachana, doshaha. Doshaha eva hi sarvesham roganam ekakaranam. So any disease it might be, it is the play of three doshas. So first we will learn about the nirukti of Ajeerna. See, I'm covering both your intellectual hunger and for your exam hunger. For both, I'm covering the topics here. So we'll take up as per the syllabus also and for your thinking process also, to nurture your thinking process. Okay. So Ajeernam iti aparipakva anna janitam. So what is this? What is Ajeerna? Adhamalla is saying Ajeernam iti aparipakva anna janitam. So from where it is originating, this Ajeerna, something called as Ajeerna, it is originating from the aparipakva anna, which is not properly digested. So one more from the Yoga Ratnakara. Prayena avaishamyad Ajeerna jayate nrunam tanmulo roga sanghatas tadvinashad vinashyati. So what he is saying, he is giving much more importance here. So roga sanghata, one is that one roga manifests. This is the first thing. But if Ajeerna is neglected, if it is not properly if it is not properly treated at proper time, it may lead to syndromic approach of a disease. That is to say, many different diseases come together and they form a pathogenesis of their own. That means to say the disease gets more complicated, more in severity. This is Roga Sanghata. Okay. So you have heard about Vyadhi Sankara, Linga Sankara, Lakshana Sankara. You have read about this, right? Hetu Sankara and all, such that Roga Sanghata is just one another term of that. So, Prayena Vaishamyat Ajeerna Jayate Nrunam. That means to say this Vaishamya is not just for one day. It is continuing for several days, several months. If this Vaishamya in the Kriya Sharira of the Pachana Kriya in the body, this leads to Ajeerna. And it is the Mula for Roga Sangata, that is the syndromes to happen in the body. So now do we understand See, any cancer, it might be, any autoimmune diseases, it might be, or any other complicated diseases like systemic lupus erythematosus or Sjogren disease, anything it might be, any samsthana it might relate to, venous disorders, arterial disorders, nervous disorders, any disorders. But the starting point of all these disorders is Ajeerna, because the nervous system is nourished from the energy that we get from the food. The muscular system is nourished from the energy that we get from the very same food. We are not eating separately for nourishing our muscular system, separately for nervous system, right? It's not like that. We are taking one single kind of food which is getting divided and particularly nourishing those parts of the body. Like specific nutrients go to nervous system, specific nutrients go to digestive system. It is such that. So Ajeerna is a root cause, that is the indigested food material is a root cause for every other disease in the body. There's a very beautiful shloka in Grahani Chikitsa-Adhyaya, Charaka, 15th chapter, saying how Ajeerna is a root cause of Mutraja disorders or the penis. There's a very beautiful shloka. We'll go through that. First, we'll understand what is the Nidana. Nidana is the etiology. So, this is a very important shloka for you guys. So, Atyambupana Vishamashanacha Sandharanat Swapna Viparyayacha Kale api satmyam laghuchapi bhuktam annam na pakam bhajate narasya ईर्ष्या भयक्रोध परिप्लुतेन लुब्धेन रुग्धैन्य निपीडितेन प्रद्वेषयुक्तेन च सेव्यमानम् अन्नं न सम्यक् परिपाकमेति. So when annam na samyak paripakam. So at what time when anna doesn't go samyak paripaka? When and all it can happen. So first one is the ahara janidana. If you cannot remember from the shloka, you can just list it out and understand. Ati ambupana, taking water in very much increased quantity at unequal intervals, or taking it in improper way or improper time or with the improper food combinations. So this is atyambupana. Atimatra bhojana, taking food in the increased quantity. Atilanghana. See, these are two extremes. Taking food very much greater quantity or not at all taking food. You're fasting for much time. So at both the cases, what happens? There might be kapha prakopa in one case, or there might be vata prakopa in the other case. Then vishamashana. Sometimes you're taking when the food when you're hungry, and sometimes patient doesn't take when he is hungry. So this is vishamashana. Asatmya ahara. You all know this. I'll not go into the details of what are all those things. Then there are specific food combinations which can cause Ajeerna. This you have to ask the patient. If he is taking dry and the unctuous foods at the same time, or taking sweet and sour things at the same time, like just after one after another, if he is taking like that, like continuously every day for every meal, if he is doing this, then certainly he is bound to get Ajeerna. Guru Bhojana. So if you have taken large quantity of food or something which is very heavy to digest, you better not eat the second meal of the day so that it gets properly digested. This may lead to Ajeerna if not considered properly. Then Vidahi, Vishtabhya and Ama kind of Bhojana, Pishta Ahara and Kaphakara Ahara. Then coming to the Manasika Nidana. What are the Manasika Nidana? Dvesha, Bhaya, Chinta, Moha, Raga, Krodha, Lobha. You might have seen like eating food when there is aversion to it. Sometimes this happens. There is no proper digestion. You might end up vomiting the food, or you might end up in Atisara. Or sometimes you're hungry but your mental state is not proper. You cannot take food at that time. But even if that time, if you force and take food, it is not properly digested, because your mental faculty, your nervous faculty, and your hormonal faculty all are related. Can I understand this better in terms of Ayurveda? Yes, it's because all are controlled by Vata. So if one goes wrong, the other process related to Vata also goes wrong. It's very much understandable, right? So please ask your patients also to be in a very calm state when they are taking food. There is one quotation in Vimanasthana of Charaka Samhita, first chapter. I hope you all remember. Tanmana bhunjita. There's one word. So what does it mean? It means that you're not contributing your digestive system with the Manasika Nidana. If you do that, then your ahara pachana kriya is at safe hands. This is what they want to mean there. Then viharaja nidhana. What are the viharaja nidhana? Vega dharana, suppressing the natural urges. What happens at this time? There is vata prakopa. At very first, there is vata prakopa. Why vata prakopa? Why only vata is important there? So, as you can remember, vata has many gunas. In that, one is called as chala guna. So, vata, if it should be in the normalcy, it should always be in a continuous motion. If the motion of vata is hampered, anywhere it might be in the body, then there is bound to get a disease. So Vega Dharana is a very classical example of disrupting the Chalaguna of the Vata. Okay, this is where all the problem starts. Swapna Viparyaya. If one does Ratri Jagarana and does Diva Swapna, so it leads to improper digestion and further Ajeerna. Then Dinacharya, Ratricharya. I'll not go into the details of this because you already know what it is all about. So just ask your patients and guide them well so that they follow all these and they can avoid disease as much as possible. There's one more nidana. We have discussed about ahara, vihara, and the manasika nidana, but there's one more important as a practitioner. You have to think about this. So what's that? It might be termed as Agantuja Nidana, just not very particular about the term, saying it as the Virechana Sneha Basti Vyapat. So if you have given Virechana and the patient is not following the Samsajana Krama later very properly, so that might lead to Ajeerna. Or Sneha Vibrama, if you have not calculated the dose of Sneha. So if say the patient was eligible for 50 ml of Grita the first day, but you have given him 70 ml of Grita, that might lead to Ajeerna for him. Or if you have given Grita, but you have not asked the patient to drink the hot sip of water intermittently, then that might lead to Ajeerna. Or if you have not done Deepana Pachana in the previous state, the first 3 or 4 days before the Gritapana, that might also lead to Ajeerna. So just think about where and all you yourself may induce Ajeerna in the patient. It's not just about patient following wrong things and he's ending up in Ajeerna. Even as practitioners, we do some mistakes giving medicines at improper time or an improper dosages. So this might also lead to Ajeerna. So give a thought to it. Desha Kala Ritu Vaishamya and Vyadhi Karshana. Yes, Vyadhi Karshana is one other important thing that you have to keep a note of. That is why? Because the person is already suffering from a Vata kind of disorder, say a Nanatmaja Vyadhi probably. So in that case, if there is no bala in the body at all, if there is no bala in the patient, then again you're giving many such medicines because this often happens. So when there is a very complicated disease, what a doctor does, what a practitioner does, they want to give more stronger dosage of medicine, or otherwise some doctors might give 8 to 10 medicines as prescription just to make sure that patient comes out of the disease. But if you have not checked the bala of the patient properly, what we might be doing, we might be actually still uh, doing the krishata of the person, or we will be even doing balahani to the patient. We have to be much precise about what must be the dosage and how many medicines I'm prescribing. That is why always a good practitioner says you have to give minimal medicines to the person. Your quality of practice is not uh, actually evaluated from how many medicines you prescribe. It is about how many quality medicines, how many and how much minimal medicines you have prescribed. That is because even with many medications, it might lead to Ajeerna. So just be careful with this thinking while you're prescribing. Okay, now coming into the classification of Ajeerna. So Madhava Nidana says Vidagdha Ajeerna, Vishtabda, Ama Ajeerna, Rasashesha Ajeerna, Dinapaki Ajeerna, and Prakrita Ajeerna. This Prakrita Ajeerna is there in every person. So if you are taking your first meal of the day at 9 o'clock in the morning until 12 o'clock or 1 o'clock, there is a digestion process which is going on. So at that time, of course, the food what you have taken is still an indigested matter, right? It has not reached the stage of pakwa. So at that time, every other person would be having Prakrita Ajeerna. That's physiology. Then there is Dinapaki Ajeerna. Sometimes, like very rarely, we might have taken Guru Ahara, that is heavy food, in one meal of the day. Probably for one day, you would be your Amashya, Pakvashya would be upset, and it might take little more time for the digestion. So the very next day, you have to take little light food so that you can actually compensate for the previous day. So Dinapaki Ajirna is this. Then the Rasashesha Ajirna. So what is this? We'll move on further. We'll look at the lakshanas of Rasashesha Ajirna and the other four, because it's little much detail than compared to the Dinapaki and Prakrita Ajirna. Okay. So where and all Ajirna can manifest being an Abhyantara Roga Marga Vyadhi now. So this is a very long shloka. This is what I was mentioning. It is termed as Samanya Ajirna Lakshana. See, even before classifying it as Vishtabda, Vidagda Ajirna or Ama Ajirna, they have given Samanya Ajirna Lakshana. So here you can see Tasya Lingam Ajirnasya Vishtambaha Sadanam Tata. Vishtamba is the very first Samanya Ajirna Lakshana is the patient might end up in a constipated state. Here the constipation that manifests in the person is not a disease, it's just a symptom. So one day if you're finding it difficult to pass the motions, that is a samanya lakshana, that means to say a very common lakshana of ajirna. Okay, that is the very first symptom that they have mentioned. Second one is agni sadhana or anga sadhana. There is some lethargy in you, so that is anga sadhana. Then shiraso rukcha. Some people say I don't feel hunger, but at that time when I have to take food, I suddenly get headache. So their evaluation of hunger is not from the stomach, but actually from their head region. So does it make any sense? Like, see, there is agni in the body, you have to feel hunger, but that hunger is actually being measured from the headache that they're getting. So when they get the headache, they take food. So this is what the wrong practice they might have landed into. So this is one ajirana lakshana. Then a patient might be suffering from murcha. This quite happens in pitta prakriti individuals. They often have giddiness. So this is one lakshana of ajirana. Murcha, brahma. They might uh, frequently go into an unconscious state, suddenly wake up. This can happen, or there can be giddiness in itself. Then there is Prushta and Katigraha. There might be back pain. Some people complain of this, like during their menses period, or even in the normal cases also. What they say is they don't take up food at proper time. Like when there is hunger, they have to take food, but they have not taken food. But after some time, just after 20 to 30 minutes, they say, pakke nauta ide. That means to say, in the flank region, there is pain. That is because of improper movement of the vata, which is one lakshana of ajirna. So ajirna is not just about when you have taken food and it has gone into indigestion. It is also that you have not taken food when there is hunger. At this time also there is ajirna. So you have to be careful of both the conditions. Then there is much yawning. You can see you're not sleepy, but sometimes you yawn too much. So what's that? That means to say there is something which is indigested in the body. There is some buildup of indigested material in the body that causes drumbha. Drumbha is yawning. Okay, angamarda, trishna. Okay, trishna when happens, if you can go back to Sushruta Sutrasthana 35th chapter, it explains about the Agni. What is the Lakshana of having Mandagni? What is the Lakshana of having Trishna? So in that, Sushruta Acharya mentions if you have Mandagni, you might have Pinasa, that is running nose, and you can have sneezing in morning hours. So we often come across these patients who complain of allergic rhinitis, right? So they say morning hours when I get up, I sneeze for some time, I have running nose, it's very transparent liquid that comes out. But after that, like as the sun rises, I don't have any such problem. It just pacifies after some time. So at that time, what we generally think about, we think about many things which are very complicated ones. We take the pride in diagnosing it as allergic rhinitis, but it's a very basic problem. It's not about allergic rhinitis there. It's actually about mandagni. So we just ask them about taking cold foods, ice cream, and such things, but we generally don't ask them about what is the hunger state in them. So if we can ask that, we can actually cut down on many medicines, okay? So it's not just about giving Haridra Kanda in allergic rhinitis. We have to just ask about what is the Manda, what is the Agni state. We can actually correct their Agni, and further we can actually avoid the person being in, I mean, ending up in allergic rhinitis. So this can also happen. Then Jwara, Chardi, Pravahana, Arochaka, Abhipaka, Annavisha, all these you can understand, right? Samsrujyamanam Pittena, Daham Trishnam Mukhamayan, Janayat Amlapittam cha Pittajam cha Aparangadan. So if somebody says that Charakacharya has not mentioned Amlapitta, please show them this shloka. This is from Charaka's Chikitsa 15th chapter, clearly saying about Amlapitta. Okay. So if Ajeerna has taken place in somebody, and if there are pitta prakriti individuals, they are at risk of developing pitta kind of ajeerna. Second, if the gut environment, that is their amashaya and pakvashaya, are more in the pitta dosha, then they might end up in all these lakshanas. Then, if they are taking pittaja kind of ahara and vihara, they might end up in pitta kind of ajeerna, getting into these kind of symptoms. Then there are some kapha disorders. What are they? Ekshma, Pinasa, Meha. So, what I explained about Pinasa in the ajeerna state, this is with the kapha kind of individual. So, if you generally ask, it is in the kapha state, in the mandagni state, they might end up in Pinasa. Okay, hefty persons or somebody who takes curds every night, they might end up in kapha type of ajeerna, which results into running nose and morning. Then what happens if it is vata kind of ahara vihara, or if it is vata kind of vata kind of an individual, or if his gut health is gowned totally by increased vata, both quantitatively as well as qualitatively. So at that time, what they might end up with, mutra roga. You know, basti is the site of vata, right? Pakvashaya, basti, and all these are site of vata. So they might end up in vata kind of disorders. Just don't think of physiology kind of disorders, okay? It can actually happen with complaints about urethral strictures, neurogenic bladder, that is all the 13 types of mutra vikaras, that is mutra ghata, mutra ukasada, mutra ushna mutra. All these can happen just because of ajeerna. So please ask very thoroughly when you're asking the history of the patient, because these cases I myself have dealt, being in the internship phase, talking about the neurogenic bladder. Just if I when I asked about the history of the patient, he said, morning I take 3 glasses of water. Every morning he gets up and he takes 3 glasses of cold water. Why is it necessary? I don't know why patients do these kind of things, but yeah, somewhere they are influenced and they do things like this. So just educate them about when to take water, when not to take water. Actually, more than when to take water, you have to teach them when not to take water. Okay, because this is the primary thing which is causing the ajeerna and further all these disorders. So you have also seen in the kapha kind of the ajeerna, right? Meha is there. That is like, if I say, if I go to the modern fraternity and I give a seminar saying diabetes, see, this is the major reason because of ajeerna. They might not understand it. How is indigestion related to diabetes? Or I'm not terming prameha as diabetes here. I'm just saying one condition of prameha is also diabetes mellitus type 2. So if I say this is all because of ajeerna, they seriously don't make a note of it, because their theory of prameha is not exactly like this. But as Ayurveda people, we clearly know that it is because of the aparipakvanna, ama, it is related to ajeerna, then forming prameha. So please make sure in every OPD that you go, whether it's Shalya or Shalakya OPD, whether it's Kaya Chikitsa, Prasuti, Panchakarma OPD, please make sure you ask the patient of Ajeerna history. Okay. Then there is Kukshi Rogan, Shakrit Gatam, so that is any related disorders of Vibandha. Then Rasadibishya Samsrishtam. They're also mentioning about Dhatu Pradoshaja Vikara. See what is the width of Ajeerna? They're mentioning the shloka in the Charaka Chikitsa 15th chapter, but they're mentioning about something which is explained in Charaka Sutra 28th chapter, saying about Rasadi Dhatu Pradoshaja Vikaras. See what is the connection between the Dhatu, Dosha, Mala, and Ajeerna. Okay. I hope your thinking pattern has widened now regarding the shloka. So now we will move on to specific type of Ajeerna. Okay, Ama Ajeerna. Ama Ajeerna is there. So what is the shloka of Ama Ajeerna? I have just put it here with the explanation part, but it says Ajeernam cha kapadamam tatra shopho akshigandayoho sadyo bhukta ivodgaraha prasekotklesha gauravam. So they're saying about Guruta, Utkleda, Ganda Akshikuta Shopa. There is edema over orbital and the cheek region. Do we ever think about edema in the over the orbital and the cheek region relating to Ajeerna? No. Even if you study the modern textbooks, they say just about being anemic. Anemic cases, the patient ends up with the presentation of edema over the orbital and the cheek region. Or sometimes in the renal failure cases, they get this. We have a quote, right? Heart sees down and kidney sees up. That means to say there is edema in the face region, face puffiness, and all in the kidney related disorders, and the lower limb is under shotha, that is in the swelling or the inflammation of the down part, and even the feet is related to heart. This is what we say. But do we ever think about ama ajirna in that case? We generally don't think about it because we are not taught that way. We generally end up saying this is a hridaya roga, this is shotha, this is pandu. But where all these disorders started, it started with ajirna. That too kapha type of ajirna. Now can we relate why kapha type of ajirna, which is called as ama ajirna, and pandu is not a rakta vyadhi? That means to say anemic cases, what we see is generally not, the etiology has not started with rakta. It has actually started with the rasadhatu. Rasadhatu is related to kapha. Kapha related to ama. So now are you able to get that straight string, how it is related? Then there is utkleda, vomiting sensation. Some people say, if they have taken little more food, they feel like vomiting it. Why some people in the indigestion state they want to vomit, and why some other people end up in diarrhea? Why is it that? Because of whether it is ama ajirna. If it is ama ajirna, they want to throw it out from the upper orifice. And when there is pitta or the vata kind of disorder, generally generally the indigested material is evacuated from the lower region. Why it is that? It's very heavy for digestion. Kapha is very heavy for digestion and there is no Agni. So the aparipakva anna is gone under dharana, that we studied the shloka before. Aparipakva annam. Amashaye stitam. So with reference to that shloka, they end up in vomiting. So I hope you're getting the idea what it is. Then Udgarascha yathabhuktam, eructation of the indigested food. So in Pitta kind of the individual, in further we will read about Vidagdha Ajirna, we get burning sensation or there is sour belching. But in Ama Ajirna what happens? There is clear belching, but whatever the food that is taken, ingested by the person, he gets the eructation of the same thing. When should we get the eructation? According to Samanya Jeerna Lakshana, we have to get the eructation at the end of the digestion, or when the amashaya is satisfied with the quantity of food that we have taken. At this time, we have to get the eructation. But when the eructation time has deviated, so you get more of eructations with whatever food that you have taken. Whatever food that you have taken should stay in amashaya. That is why it is called as amashaya, right? Where the process has to go through. But if it comes to esophagus, back to the gala pradesha, then to the kanta pradesha, and then to the mouth, is it normal physiology? No. But we are not taking count of this. We just ask the person. I mean, many times we don't even ask the patient whether they are getting eructations, belchings. We don't ask them. But we have to ask them about it, and we have to also ask about the contents of the eructation. Okay, just keep this in mind when you are taking the history. Then coming to the Vidagdha Ajirna, that is of pitta type of Ajeerna. So what the shloka says, it says, Vidagdhe bravatrun murchaha pittascha vividharajaha udgarascha sadhuma amlaha svedo dahascha jayate. So what it is to say, ingested food becomes sour and slightly digested. They can end up in brahma, they can end up in thirst, increased fainting. Sadhuma Amla Udgara. So, as I mentioned earlier, so erectation is not a clear erectation. It's neither clear erectation nor it is just the food particles that you have taken. But what happened here? Digestion is little more because the pitta, the acids in the amashaya have acted up a little. So, they have converted the food that you have taken into little more amla avasthapaka, giving out the result as sour erectation. And sometimes patient also complains of always having burning sensation in my esophageal region. They normally complain about chest burns or heart burns, right? That is what most people correlate with acidity. So this you have to ask where exactly. So when you ask about the burning sensation, it is in which area, you will understand the chronicity of the disease that they are suffering from. See, where the burning sensation has to happen first. Does it happen in the mouth first, or does it happen in the Kanta Pradesh or in any other place? This you will understand by understanding where is the Agni Adhishtana. So now you know the Adhishtana of the Agni is Grahani. So the burning sensation has to start from that area if it is in a very acute state. That means to say, if it is in the earlier stages of the disease manifestation, they will find indigestion. They find this burning sensation in the abdominal area. Then it shifts to the stomach area. Then it shifts to the thoracic area, then it shifts to the heart area, then it's cardiac, then it shifts furthermore upwards to the esophageal region, then to the Kanta Pradesha, then to the Mukha Pradesha. Finally, so if somebody says, if a patient complains of dhuma, that is sadhuma amla udgara, then it has to be, I mean, the disease has to be manifested at least for 2 to 3 years and it is not being treated properly. And this happens very much often in patients who are under this H. pylori medicines and enzymes, digestive enzymes, and also antacids. They are often prescribed with antacids. There is so much suppression because of that. And then finally, they end up in sore erectation. Often we find this in GERD patients, GERD. I hope you can go back and refer all those terms which I am mentioning now. Some might be very common, some terms might be new terms for you. So just go back. You can read through the textbook. Okay. Then the next one is the Vishtabdha Ajeerna, Vata kind of disorder. So what it might be? Vishtabde Shulamadhanam Vividha Vata Vedanaha Vata Apravrittischa Stambho Moho Anga Pidayan. So this is saying about Vishtabde Shulamadmanam. So the very first thing of Vata is about Ruja, the pain. So there is severe pain in the abdomen. This can be a generalized abdominal pain or it can be at specific time in the digestion you might get pain. I think you are aware of peptic ulcers, gastric ulcers, duodenal ulcers. And here there's a very specific pattern of pain, food and relief. We just have to go through all these and we will discuss further when we come to Annadrava Shula or Parinama Shula and all. But there is specific pattern of pain. So pain itself has different categories now. And pain can be in the abdomen, pain can be in the kidney, region of the kidney. The pain might be at the umbilicus, pain might be at the bladder. So you have to be very careful about asking these cases. Okay, Vishtabda Ajeerna can be many different presentations then. Okay, then Shula, there is sharp colic-like pain. So colic pain, where do we find generally? We find it in gallbladder stone cases or there is gallbladder infection. So at that time, we find this colic pain. Then there is hardness of the bowel. Then there is opposite movement of the Vata dosha. So what is this about? So you find more belching in some cases. In some cases of gulma, you find this increased belching. The patient says, while I'm hungry, like I don't generally feel hungry, but whenever I feel like taking food, before I start to take food, I get multiple erectations, multiple belchings I get. And it doesn't stop. Even after, only after I take food, it stops. This is the typical complaint that the patient gives. Okay, this is about Vishtabdha Ajeerna. It is not something which is very great, diagnosing it as Gulma or further any other disease. You have to come from the basics, that is Vishtabdha Ajeerna. Okay. Then there is Malavata Apravritti, obstruction in the evacuation of feces. So this obstruction in the evacuation is not just simply termed as constipation. Constipation is, I tell you, it's a very vague term. Uh, Constipation, that is, you generally correlate directly as Vibandha, but Vibandha in itself is of many categories. It can be due to Vata. That means to say there is Rukshata in the stool, in the fecal matter, or if there is no rukshata but still there is chalaguna which has been hampered, or it can be like kapha has increased, the mucus has increased, or it can be like there is no propulsion movement in the fimbriae that are there in the rectal region, in the large intestinal region, or there might be decrease in the enzymes that propel the stool further. See, now only we listed about like 5 to 6 different presentations of constipation. So just don't limit yourself asking the patient, okay, do you have constipation or your bowels are normal? Just don't limit yourself at that point. Please do ask some other specific questions, like when, at what time you get the feces passed in a day, or what is the consistency, or how many times in a day you get it, or for how many days once you get it. Do you strain when you pass the feces, or after how many, I mean, some people like a Pitta Prakriti individual might pass the stools like 2 or 3 times a day, right? So some people might have already gone into the Grahani stage, and they might say, as soon as I take food, I feel like evacuating. Or some people have made it a habit that every time they take food, they have to run to bathroom and they have to pass the stools. Even though the stool is not actually coming, they want to pass it forcefully. So all these things you have to be very specific while asking a patient. Okay, just don't limit yourself for very common questions like, okay, mala pravritti, they have said ashtasthana pariksha, there's mala. Just don't ask them, okay, do you pass mala every day or not? Just don't limit yourself there. Do ask little more specific questions so that you can uh, there only you can be sure of whether the patient is suffering from Ajeerna or not. Okay. Then there can be headache. Headache is a very specific symptom and it's a very common symptom that we find in the OPD. One more thing here is the Stamba Anga Pidana. Moho Anga Pidayan, it is called. So what is that? Stiffness and pain all over the body parts. This generally happens in coastal areas. I was working in the coast, I mean, the rural area. For the rural posting, I was working in the coastal areas. So they generally had this complaint of saying stiffness. There's stiffness and pain all over the body parts. So what they use there is generally what they take is uddu, that is masha. They prepare much food items with masha. And as you know, masha is a guru ahara and it is not properly digested, and they generally face this. In Bangalore, I think we can generally differentiate, I mean, we can categorically decide this is Amavata, this is Sandhivata. But while I was working there, my teacher taught me saying, see, here in the coastal area, we generally don't get Amavata and Sandhivata very categorically, but there is a mixed presentation saying patient comes with a complaint of Sandhivata, but when we actually check them, they have a combined presentation of Amavata and Sandhivata. So this is exactly the presentation of Vishtabda Ajeerna. Because of the Guru Ahara, there is Ajeerna, then there is Ama, then they end up in Amavata and Sandhivata together. That is the stiffness part. Okay, fine. So now we are coming to Rasashesha Ajeerna. So what is this Rasashesha Ajeerna? So Rasashesha Ajeerna is Rasasheshe Anna Vidvesho Hrudaya Ashuddhihi, or there is Hridaya Gaurava. So you feel like to say you don't feel very much comfortable. There is some irritation, there is some difficulty in speech. You don't feel like concentrating on anything. When there is indigestion, no, you generally cannot focus on anything. This indigestion kind then finally leads to jvara. So this is what Rasashesha Ajeerna is about. This is not Prakrita Ajeerna or it is not Dinapaki Ajeerna. But for some days, this Ajeerna is there, and it is almost always related with Manasika Nidana than with Ahara and Vihara Nidana. Okay, there is no this clear erectation, but then even after the erectation, there is no desire for food intake. Ananya Abhilasha is there. So we generally know that from the Jirna Ahara Lakshana, Udgara Shuddhi should be there. After Udgara Shuddhi, what is there? There is Laghuta, and then Anna Icha is there, right? But in Rasashesha Ajirna, even though there is clear erectation, there is no desire for the food intake. So what is this? This is one kind of Rasa Dhatu Pradoshaja Vikara. You can just go back to Charaka Sutra 28. It says Ananna, Aruchi, Ananna Abhilasha, Asya Vairasya, Rasagnata, Pandu, Staulya, all these they come under Rasadhatu Pradoshaja Vikara, and the very basic thing that happens with the Rasadhatu Pradoshaja Vikara is Rasashesha Ajirna. Then there is Hridaya Guruta, heaviness in the heart region. That means to say this is one very common symptom in patients where they say, I have taken food, I have taken much food, or they generally do adhyashana. That means to say take 4 or 5 meals a day. Then there is no scope for Agni to properly work and properly digest. At that time, there is dharana of Anna for more time in Amashya. So what happens? This more and more and more. There is, of course, I know that stomach can expand to 30 times its normal anatomical specifications, but generally it doesn't happen like that. So when you keep on pairing up more and more and more, piling up more and more foodstuffs into the amashaya, what it does, it pushes the diaphragm above. So what this pushing of the diaphragm to the above anatomical region does, it does heaviness in the heart region. So now heart is like, it is compressed. First of all, the heart is compressed between the two rib cages and the lungs. And above that, from the downward also, there is much quantity of food in the amashaya, and further it is compressing the heart. So there is hridaya guruta. So if the patient says, I generally feel heaviness in the chest region, be specific in asking them whether you find it a generalized heaviness in the chest region, or just in the heart region you find that heaviness. If they're saying there is heaviness in the heart region, you must further ask them specific. Is it like after taking food, do you feel that? Or when you are in empty stomach, you feel that? If they say after taking food, they feel that, you can make a diagnosis of Rasashesha Ajirna. Okay, I hope you're getting where to concentrate little more in asking the history of the patient. Then there is dislike towards the food. When there is some more quantity of food that is still there in the amashya, which is not yet digested, then of course you wouldn't feel to eat more, to take food again, right? I'm not talking about the habitual people who take food for every 2 hours, snacking for every 2 hours, binge eating. I'm not talking about that. I'm just talking about the physiology here. So the physiology doesn't allow you to take the food, but it is just that the habitual eaters, they might take food very frequently. So of course they might end up in Rasashesha Ajirna. Then two other different presentations are Dinapaki Ajirna and the Prakrita Ajirna. Dinapaki Ajirna is Nirdosha. Food get digested within a day if you just give some time. See, for example, you go to a marriage, you take more food that time, little more quantity of the normal food that you take at your house. So if you give much more time, say like about if the food get digested generally in 5 hours, when you take food in marriages, it might take 7 hours. So that's good. There's no problem with that. If you give little more time, a little more peaceful time for your amashya and pakvashya, the food get digested within a day. And prakrita ajirna is a very prakrita condition, that's physiological condition, the natural indigestion during the process of digestion, which will complete with time each day. So this is about prakrita ajirna. So now I have come up with some of the statistics that I discovered while googling some of my questions. So putting up questions in the browsers. So this is one of them. Share of respondents with acidity and indigestion problems across India during 2019 by the selected city. So one city that is there here is about Bangalore, that like being in Karnataka, I'm just taking up Bangalore. So this is 31.3% of people in very normal condition also, even if they are not getting any major symptoms that is actually deviating them from their lifestyle, normal lifestyle, but still they have indigestion, is 31.3% people. Okay, now do you understand how much critical it is, how much time bounding and how much energy it requires for the doctor to actually go pick up the smallest of the symptoms? See, patient, what they generally do, they don't generally come up to the doctor until and unless they have a very critical symptom which is actually probing a problem to their lifestyle. They must have an acute pain, or they must see some blood. Until and unless they have something very critical like this, they don't turn up to a doctor. But for these things to get so much severe, Ajeerna must be there from so much time before. So it is a duty of the doctor to ask the patient. So just in the city of Bangalore, if we can find this under like the subclinical cases of major disorders, it is about 31.3%. So in Kolkata, it's much more. See, 38.5%. And one more statistics saying indigestion is a common condition affecting about 1 in 4 people. This is US statistics. So indigestion is a very common thing. If population of uh, any country is so and so, in that every other fourth person is having indigestion, how many people are actually suffering from a disease? It's not that very fancy diagnostic vyadis are actually diseases. No, it actually starts with the mula. The basic one is Ajeerna. So please take care of that. Then acid reflux statistics. How common is it really? So approximately 60 million adults report suffering from acid reflux at least once per month. So this is, what is this? This is Vidagdha Ajeerna. So statistics indicate that at least 25 million people are suffering from it each and every day. That means 1 in 14 individuals out there is dealing with it. Then I have taken statistics from other disorders which are in the futuristic plans of the Ajeerna. So once the Ajeerna sets in the body, it has some future plans, as we all do have. So it might turn up into an abdominal wall hernia, chronic constipation, diverticular disease, gallstones, GERD, gastrointestinal infections. For all of these, for these hemorrhoids, IBS, Crohn's, ulcerative colitis, any disease it might be. For every disease, the major cause, the root bug is Ajeerna. So just see the statistics here, how many patients are suffering from it. So the surgical procedures, just for the abdominal wall hernia, the surgical procedures are going on. So how much it is? It is like 5,26,000 people. In 2006, they have undergone surgery for abdominal wall hernia. If we could just note some, at least some, a few patients in their Ajeerna state only, they might have not ended up in surgical procedure, right? So for every other disease that they have mentioned here in the statistics, they have the hospitalized cases, mortality cases, how many people have died from abdominal wall hernia. If we were able to take note of their Ajeerna in the very early stage, they might have not undergone surgery, they might have not been dead today, right? They might we can actually improve their Ayu. That is what the motto of Ayurveda, right? So then there is prevalence of the GERD. So babies hospitalized for GERD in 1998 and 2005. There's so much increase like that, some statistics. Okay. Now coming to the core aspects of the Ajeerna Chikitsa. The very important shloka is Tatra ame langhanam karyam vidhagde vamanam hitam vishtabdhe svedanam patyam rasasheshe shayitacha. So it says for the Ama Ajeerna Langhana is the primary chikitsa. For Vishthabda it is Svedana. For Vidagdha it is Vamana. And for Rasashesha it is Shayana. This is the very common thing that has been mentioned. Once again, I'll repeat the shloka, a very important shloka. It is not just the Ajeerna Chikitsa, as I told you in the previous class only. Ajeerna, I mean, even for the Atisara, Bhava Prakasha mentions go back to Ajeerna Chikitsa and treat Atisara as like Ajeerna. If you take Gulma, the other acharyas also say go back to Ajeerna, treat the Ajeerna. Then you can treat the the further presentation as gulma. So in every abhyantara roga marga vyadhi, you need not think about the vyadhi specific chikitsa. You actually have to think about Ajeerna chikitsa. So please make a note of it. Once again, we'll go through. Tatra ame langhanam karyam vidagdhe vamanam hitam vishtabdhe swedanam pathyam rasasheshe shayitacha. I hope you know what are these terms. So one more shloka from the Ashtanga Hridaya. So why particular chikitsa have different states? So Kapha has Prithvi and Ambu as its Pancha Mahabhuta constitution. Pitta has Agni and Ambu, and Vata has Vayu and Akasha. So these particular chikitsa are because of the Panchabhautic state of these doshas. So let's see how it is that. So the first one is about faster evacuation than fires. Any abnormality of the fire is avoided and there is less injury because of Vata and Ama. So this is the primary motto. So what is the shloka? Ame langhanam karyam iti utklede tatrapi vamanam avasthikam. So first we said tatra ame langhanam karyam. But this Yoga Ratnakara mentions a slightly different thing, saying about we have to do Vamana Chikitsa in the Amavastha. So why is there a difference? Sushruta says we have to do Langhana, Ashtanga Hridaya says Langana, but Yoga Ratnakara says Vamana. So it is just that in Alpa Dosha of the Ama Avastha, we have to do Langana. If there is Bahudosha Avastha and Ama state, then we have to do Vamana. So the faster the evacuation, that is through the Vamana, if the faster is the evacuation, then we can get hold of Kapha and the Ajeerna state. Then fires are avoided. So what is this? Vidagdhe Vamanam Hitam iti rasasya amlasya vyapannasya anudharane kushtabhada bhayat. So if there is increase of pitta in the body, so what happens? This pitta acts up more on the tvak along with the rasadhatu and the raktadhatu, and then leads to tvagamaya, kushtha. So in order to avoid the pitta vidagdha, vidagdha pitta of the Ajeerna state to end up in kushta, that is tvak amaya, that is any skin disorders it might be, we have to take care of the excess pitta that is there. That is Agni and the Ambu. Pitta that has deviated to Agni, or Agni which has got more of Drava quality now. Quantitatively it has increased, but quality is no more there. So at that state, what we have to do, we have to take out the excess pitta. So one thing what we can do is Vamana, and the best thing what we can do here is Vamana. Okay. Then less injuries. If there is more Vata with the Chalaguna, Ruksha Guna, it causes more injurious results in the body. So in order to avoid that, what we have to do, we have to give Ushna Chikitsa. So Vata has Shita Guna in it, Ruksha Guna in it. What you have to do is give Ushna Guna to it, Snigdha Guna to it. So what we have to do here, Svedanam we have to do. So what it can do, this Svedana, it can actually take control over Ama and Vata. Then one more thing, core aspect of the Ajeerna Chikitsa, one more important thing. It is not always just about Ama Ajeerna treated by Langana, Vishtabda by Svedana, Vidagdha by Vamana, and Rasashesha by Shayana. But it is actually what is important is the Avastha Vishesha. Even in the Ama state, if there is Bahudosha Avastha, you must go with Vamana. Okay? When there is Ama Avastha, there is much Shtula, then you cannot just sit with Langana, you have to give Basti Chikitsa. So it is always, just don't go with something which is mentioned as this to this. Ayurveda is never a formula like medical system. It always goes with the avastha vishesha. What is the presentation in that individual at that particular time frame? That is what avastha means. So you have to go by the chikitsa like that. So Ashtanga Hridaya is saying this shloka, त्रिविधस्य वैस्य चिकित्सं माह लङ्घनं कार्यं मामेतु विष्टब्दे स्वेदनं भृशं विदग्धे वमनं यद्वा यथावस्थं हितं भवेत्. So what is this avastha? Yathavastham hitam means yasya ajeernasya yasya amavasthayam yat hitam. So in which state which treatment is hita, you please do that. This is what Vagbhata is teaching us. तस्य आमवस्थायां तष्कार्यम् इत्यर्थः, that is tat karyam ityartah. Vibhaga niyamastu bahulyabhiprayana. So which dosha is in bahulya, which avastha is in bahulya, which kind of ajirna is in bahulya, that kind of chikitsa you have to do. So every time it is not just there is only kapha increase in that person. So it cannot be always an eka doshaja vyadi. It can be a dvidoshaja vyadi. It can be a samsargaja kind of vyadi, sannipataja kind of vyadi. So at these states, you have to think about what combination of treatment that you have to do that is related to your yukti. So what does a fireman do now? So Yoga Ratnakara explains few other chikitsa techniques. So you can use vacha and lavana for vamana. You can use ushna and lavanambu. You can use dhanya nagarasiddhatoya for vamana. And if there is shula, then you have to go with basti. So one more is in pitta kind of state. What you can do is shitambu. The first thing what you have to do is as the pitta, that is to say vidagdha ajirna person should always take shitambu snana, shitambu pana. Okay. Then for the vata kind of disorder, that is the vishthabda ajirna, what is the chikitsa here? Swedana, ushnapana, the paste of trikatu. This we can ask the patient to do. The Svedana with like Udvartana kind of a thing can be done with the Trikatu, Udgharshana also. Then, one very important shloka, Ajeernino Bheshajam Nishedha. So, when you should not give medicine to the patient, this is very important, right? So, giving chikitsa is one important aspect, but at what state giving treatment itself is a contraindication, that also you have to know. So, when there is acute pain, at that time you're not exactly treating the ajirna. Okay, never in the painful state you are giving ajirna medicines, the medicines which can pacify the things, you're not giving it. Okay, tivra artirapi na ajirni, even though there is so much pain, tivra arti in ajirna avastha you shouldn't give na ajirni. Pibet shulagna aushadam. Shula is pain here, so shulagna aushada, that medicines which actually pacifies like analgesics kind of things. Why it is not preferred in Ayurveda is because of this, because there is Ajeerna avastha in the body. That is why there is something which is presented as pain, or something which is presented as bloating, something which is presented as constipation. So at that time you aren't giving, if there is colic pain, at that time you're not giving analgesics, rather you are treating the disease and getting rid of the pain, but you're not giving medicines which can just pacify the pain, because pain is something which is shown by the body. It is a homeostatic procedure. It is a physiology of the body to show you pain such that you can take care of the disease. You can take care of the etiology. You can mark the etiology. That is why the pain is shown as a symptom. So never suppress this pain and say, I have treated. No. That is why giving analgesic is not a treatment. It is just a maintenance therapy. But on the long run, it is going to cause much more problem. Then Ajeerna Kula Khandana Ganaha. This is one very practical thing that has been explained by Yoga Ratnakara. If somebody has taken more of Jambira Rasa, like say Nimbu is taken more, that's lemon is taken more, you give lavana to that patient. So whenever we prepare this sharbat, right, Nimbu sharbat, we do add little quantity of jeera, or we add little quantity of sugar, we add little quantity of lavana. Why? Because the combination of this doesn't cause injurious results in the person. Nimbu sharbat is needed, but at the same time you have to take care of your gut health, so you are adding little lavana. So when somebody has taken more of jackfruit, what you have to ask the patient, there is indigestion because of more of jackfruit, eating more of jackfruits. What you have to ask the person to do, after some time you have to ask the person to eat bananas, then one banana say, or two bananas. Or if they have taken dosa, idli on a very long run, what you have to ask the patient to drink, you have to ask the patient to drink takra, that's buttermilk, very properly churned buttermilk, that gives very much relief. So here you are actually not giving medicine, but you are giving food as itself as a medicine. One more example is narikela phala. So in some households, coconut stuffs like coconut oil or grated coconut is used more. So in that case, tandula can be used. And in some other cases, rasala. If somebody has taken more of ambra, that is mango, what even in the household, even your mother or grandmother might say, just drink a glass of milk. It can suffice. It can pacify the ushna that has been created by ambra. Right? These are some examples given in Yoga Ratnakara. There's a long list you can go through. Then chikitsa. So what is the very practical thing that you can do now? One is bahya chikitsa, other one is the abhyantara chikitsa. Bahya, you can do with alepana with hingu, tryushana, saindava. The combination of this, you can do the alepa or divasapna. Like if there is dinapaki ajirna or say there is rasashesha ajirna, only that day you can just wake up little late so that the digestion process is complete and you can pass the bowel. Then abhyantara, there can be churna, gutika, rasayana, yavagu, patha, grita, rasaushati. So even when you're writing in the exams, if the question says about give a detailed description of Ajeerna and mention some shamana aushadis. So you have to be answering that question in this manner. Say churna, give two examples, gutika, give two examples. So we'll see that. So responding to a malfunctioning Agni, Pathyadi churna, Lagu Vaishwanara churna, Hingvashtaka churna, you can give this. So Pathyadi churna, you can, if there is Vata Pradhana Vyadhi, you can give Pathyadi churna with Ushna Jala. If there is Pitta Pradhana Vyadhi, then you can actually give with uh, like the supernatant water that is there in the in the curds. That thing you can take. Okay. So then in the case of in the case of Kapha Pradhana, you can give Ushnodaka. You can give. And there is Hingvashtaka Churna, you can give with Grita. Then Lavana Bhaskara Churna is there. That also you can give the first morsel of the food. It can increase the Agni and further stop the Ajeerna process. Then if you come to the Vati preparations, you have Shankavati, Sanjeevini Vati, Shallavati, Shankhavati, all those. Dhananjayavati. Then if you come to the Rasayanas, you have examples of Amrita Haritaki, Vidangavaleha, uh, then something with the combination of Draksha, Sharkara, Madhu, put it as an Avaleha and give. Or you can give Haritaki, Sharkara and Madhu and Amalaki together mixed with a little ghee you can give, right? So then further moving on, we have Kwatha, which is done with Lavanga, Pathya and Saindhava. Pathya is Haritaki. So that you can do. It's very much there in your households, right? You need not actually give medicine which is already prepared. These have to be very fresh for the Agni to get brightened up. Then in the form of Grita, you can give Dashamuladya Grita. In Rasaushadhis, you can see there are a few examples here also. Agni Kumara Rasa, Agni Mukha Rasa, Bruhat Kravyada Rasa, all these. So here we end up the topic of Ajeerna Chikitsa. There are a few other points I want to highlight, which you have to keep it in mind as a practitioner, as a medical student, as a very responsible person of the society. So we'll think about that now. So what pathya and apatya you're going to say to the patient? The very first thing that you are going to say to the patient is to take the food in such a quantity which is in accordance with their Agni Bala. Okay, this has been told in the Dinacharya Adhyaya itself. Matrashi syat. Every person has to take proper matra, quantity of food, ahara matra, which is in accordance with the Agni Bala. Punaha Agni Bala Pekshin. Always you can lessen the injuries, lessen the risk, lessen the further manifestation of complicated symptoms. How you can do that? By diagnosing the primary stage properly. Rogamadav pariksheta tadanantaram aushadam. So always give aushada only after proper pariksha of the roga. Tataha karma bhishak pragna gnana purvam samacharet. So only when you act decisively, when you act uh, as a very much responsible doctor, for the first thing what you have to do, the first action of a responsible doctor is to examine, then to give the aushadha. Just don't go with a symptom that a patient has actually presented to you. Just don't go by patient's words. What is your duty then? So you have to ask more into the history, take a proper history, do the pathogenesis properly, understand the samprapti properly, then give the aushadha. So there are 1440 minutes per day. If that's counted into 100 years, it becomes 5 crore 18 lakh 40,000 minutes. Okay, total this is, if you say, generally it is said as 100 years is the lifespan of an individual, a human. So you would be living almost 5 crore plus minutes. In that, if you take up at least 1 hour, say you have 3 meals per day or 2 meals per day, and you subject 60 minutes of your day, in a day you take 1 hour for eating at different times of the day. Then if it is converted into 100 years, then you would be taking up 21 lakh 60,000 minutes you spend for eating food. So if you want to be healthy for 5 crore plus minutes, you have to just invest 21 lakh minutes. What is that? If you can take care of your Agni, if you can take the food just in accordance with the Agni, that's come, it doesn't even come to around 10% or 20% of your total lifespan, the minutes that you are living for 100 years, right? If you can just be in control of 20% of the minutes in your life, you can actually be healthy for 100% of your life. That is what I just wanted to show you. So this you have to make your patients also understand. So some statistics saying there is 74% doesn't even experience hunger before eating. You have to break this chain as a doctor. Then some other 18% eat untimely. Sometimes they experience hunger and they eat, sometimes they don't. And there are men, the percentage is very low as to about just 8% who eat just as per the Agni Bala. So if you want to bring a change in the society, you have to start creating awareness of the Agni Bala of the patient. मात्राशी सर्वकालं स्यान् मात्रा हि अग्नेः प्रवर्तिका मात्रां द्रव्याण्यपेक्षन्ते गुरूण्यपि लघून्यपि. So your Agni Bala is decided with the ahara matra that you are taking. So how your ahara matra should be, it has to be in accordance with the dosha, dhatu, mala and amashaya, the gut health. So all these gives you a proper Agni, and when you take proper food, it gives you a proper end result. So Agni related chikitsa in a nutshell. So at first step, what you have to do is to stop. What you have to stop? The untimely practices, the wrongful practices you have to stop. Even though, like after that, if person is having some complicated presentation of a disease, don't panic at that stage, but rather give Deepana Pachana medicines at first. Then the third thing is to line up. So what you have to do, you have to line up all the symptoms that the patient is presenting and start with the initial diagnosis of the Ajeerna. This is how you line up your diagnosis. Then get aligned. What you have to get aligned here, the pathological state of the Agni, bring back, align it back to the cardiac cycle, to the biological cycle, so that you bring back the Agni from pathological state to the physiological state. Then listen. What you have to listen, the very important thing in the chikitsa is to listen to your body. That means to say, when your body says there is hunger, only then you have to eat. So this is the Agni related chikitsa in a nutshell. So thanks for listening and being a part of this discussion. So I'll just end this session with a shloka, then we can take up the doubts. रागादिरोगान् सततानुशक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै.